President Biden asking all states and local governments to offer $100 cash to anyone who gets a COVID vaccine right now, saying that the Treasury will fund it. New York State has already started offering that to those in their area. Also, in his address today, the president announced that federal workers will be masking again and be required to either be vaccinated or get regular COVID testing. He's concerned the pandemic is heading in the wrong direction.
What I'm trying to do is keep people safe. I mean that sincerely. So, if in fact you're unvaccinated, you present a problem to yourself, to your family, and to those with whom you work. We are not fully out of the woods yet, because what is happening in America right now is a pandemic of the unvaccinated. Let me say that again. It's a pandemic of the unvaccinated.
Because right now, half the U.S. is still unvaccinated against COVID. Texas is sitting at a 43% vaccine rate. And the president said COVID cases among the vaccinated do happen, but are rare. And Houston medical experts are telling us the same, saying what few breakthrough cases they do see are mild, if not asymptomatic. And on a large scale, it is overall hard to track the numbers. The CDC does not track vaccination status alongside new case data, but local medical leaders tell us that breakthrough cases do not account for the rise in cases overall right now. Our Maria Salazar has been looking into this. She's looking at how children are faring against the rise of the Delta variant of COVID as well, considering many children are not eligible for vaccines. She joins us live with what she's learned tonight. Hi, Maria.
Hi, Caitlin. Well, I spoke to an expert from the Texas Children's Hospital, and he says that the Delta variant is behind more than 80% of COVID-19 cases among children, just like we're seeing in adults. Now, the hospital reports that they have seen an uptick in hospitalizations in the last month, and they've really picked up in the last 2 weeks.
It's important to emphasize that because in a wholly unvaccinated population under 12 years of age, it's no different now than it was last summer in 2020 for these children.
Dr. James Versalovic, interim pediatrician in chief at Texas Children's Hospital, believes the impact of the Delta variant is just beginning to unfold among the pediatric population.
The children are presenting now a little differently with the Delta variant. More prominent fever and congestion.
He says since the start of the pandemic, Texas Children's has diagnosed about 15,000 cases of COVID-19. Roughly 10% end up hospitalized, and about a third of those in critical care.
We have had some children that have required ventilator support. This is why we're also working so diligently on making vaccines available to children under 12 in the near future.
He believes it's the unvaccinated or partially vaccinated adults and older adolescents who are infecting children. And although most cases are mild,
some children may present 3, 4, 6 weeks later after a very mild infection with MIS-C, which can be very serious.
Or multi-system inflammatory syndrome in children. As for breakthrough infections among those 12 and older who are vaccinated,
we don't have firm numbers on breakthrough infections in adolescents. It's a much more recent phenomenon.
And Dr. Versalovic says that the best thing parents can do to protect their children is as parents get vaccinated themselves. He says, second, if the kids are older than 12, get them vaccinated. And lastly, he says if parents suspect that their child has COVID-19 or is showing cold-like symptoms, talk to their doctor to see if they should get tested for COVID-19. Maria Salazar, Fox 26 News.